Welcome, everyone, to our LinkedIn Live today. We are extremely excited that you have taken a small part of your day to join us. My name is Stephanie Dorwart, and I am the President and CEO of Altius Healthcare Consulting Group. Altius, for those of you that are not familiar with us, really focuses on improving the financial and operational performance of healthcare organizations. And we do it by educating, elevating, and empowering healthcare leaders so that they're able to deliver the highest possible quality of care and with the lowest possible cost. I am joined today by my colleague and friend, Mickey Heinley.
Hi, how are you? I am Director of Business Development at Altius, and today I'm going to play the role of you viewers. There's a lot of questions that you probably have about productivity and leadership, the role of leadership development, the importance of having a consultant, and why timing is so important. So I'm going to make this a fun Q&A, kind of a back and forth formats. And if you have any questions that I don't cover, please put them in the chat and we'll cover them.
And before we get started, we would love to know where you're from. So if you want to drop in the chat, what city and state are you watching from? What organization are you with? What's your role with your current hospital healthcare organization, or what type of organization you're serving with? We like to interact with our audience, get to know you so you get to know us. As Mickey said, if you have any questions, drop them in the chat. We're going to focus on proactive consulting and the cost of delays and everything else in between. Sometimes we go off script. So I can't guarantee where this is going to go, but your participation would be fantastic. So let's get started.
Oh my gosh, that's awesome. So we all know that healthcare is rapidly evolving, and there's so many challenges, rising costs, staffing, there's increasing regulations, changing patient needs and volume. So the big question is, how can healthcare organizations manage all these issues while still providing quality care?
Oh my gosh, healthcare is changing rapidly. How many of you have change happening at your organization? Everyone, right? And so organizations really need to focus on, healthcare productivity and, focus on providing quality of care and managing all of these things, because it is the core differential that's going to make the difference in their organization. When we're focused on what matters, what we focus on expands and we get more of that. So that is why we all need to focus on these components: high quality of care, strong productivity, efficiency, effectiveness, leadership development.
Okay. Well, let's start with the basics then. Can you explain exactly what healthcare productivity is and how it applies to organizations today?
Yes. So healthcare productivity at times is very misunderstood. There are a lot of different definitions for what productivity is, but healthcare productivity at its core is really about maximizing resources, maximizing the staff members that you have, workforce optimization, while at the same time minimizing waste, making sure that we're doing everything at the lowest possible cost. So when we're focused on healthcare productivity, it's performance improvement. It's workforce optimization. It is doing more things right and effective so that we can get the best results.
So you mentioned something about costs. We know it's not just about cutting costs. So can you share a little bit more about how improving outcomes and staff satisfaction can be achieved in a balanced manner?
So when you're focused on outcomes, you're focused on, productivity. And again, you're focused on those end results. Everything else rises. And when you're, looking at this, you're going to improve your change management components. You're going to focus on your conflict resolution. You're going to improve your quality of care. You're going to improve your patient satisfaction. Your length of stay improves because you're focusing on the overall outcomes. And as you do this, everything within your organization rises. So why should you, look at productivity consultant? Why should you look at consulting in general? Because you're going to focus on the end results. And when you're focusing on that, everything else shifts. Transformation doesn't happen in a vacuum. It happens as you're focusing on that end result and getting from where you are today to where you want to go in the future.
So how would then the staff know how to get these results? Let's talk a little bit about leadership development. How does leadership development play a role in productivity?
Oh my gosh, leadership development is probably one of the most overlooked areas of healthcare in general. And honestly, it's probably overlooked in every industry. We're very good in general, within multiple industries, especially in healthcare, of recognizing really strong clinicians, recognizing people that have the skill sets to move into leadership development, and then saying, congratulations, good luck, and pushing them out on the units without giving them the leadership development skills. So why is leadership development really important? Well, number one, it promotes confidence. Your department's performance is only going to raise or go to the level of confidence of that individual leader and their individual capabilities to actually execute on their plans, execute on what they need to do. If they don't have the confidence to take the steps to actually achieve those goals, to make those changes, nothing's going to change. So why is leadership development important to productivity? It's important to productivity because it raises confidence. It's important to productivity because it raises the individual's belief, the leader's belief of what they're capable of and what they can influence. It's important because it helps them enroll their staff and it shows them the why behind what they're doing. So leadership development touches everything in productivity.
So what are some areas that leadership development touches on that makes a big difference? What are some particular examples of items that you work with?
Well, that is a great question. I think one of the first things that comes to my mind is I think of what does leadership development touch? And I'd love to hear from all of you, what are your key points of leadership development? What do you think it does to influence productivity? But first thing that comes to mind is decision-making skills. A lot of times leaders, organizations stall. They hesitate. They sit there, they look at the data, they mull over the data, they have conversations, they have meeting after meeting after meeting after meeting, but no one's actually making the decision to move forward. So number one, leadership's going to promote decision-making capability and give the leaders confidence to make those decisions without hesitation so that things can move forward. You cannot move forward in your department, in your hospital, in your healthcare organization without making a decision to move forward. So number one, decision-making capabilities. Number two, leadership's important because of change management. It allows you to actually manage the changes.
So many changes.
So many changes, but if you don't understand how to navigate that as a leader, you don't understand how to manage that, how to have the difficult conversations, you're not going to actually have the confidence to execute on the plans. So leadership development is important because it helps you to actually understand what you need to do and the levers to pull and how to go about doing that.
And how about emotional intelligence? Like, how difficult is it? I know that so many high-performing leaders get elevated. They're nurses, they're great on the floor, and then they get elevated, but then they never were taught how to be managers or how to have those conversations. And then you have so many different generational changes, and you also have so many different personality types.
Emotional intelligence is important in any situation, healthcare, outside of healthcare, for you to be able to read the other person, read the situation multiple times, sometimes in the middle of a difficult conversation, read the room and understand how to respond. You might be dealing with someone that's extremely analytical, and physicians and surgeons tend to be extremely analytical, and a lot of people in healthcare are analytical. We also tend to be supporters because we got into this because we're mission driven and we want to make a difference. So we have to touch upon, what they might need. If they need the numbers to back up their decision, then you have to provide that analytical. But if you don't understand that they are someone that has to get into the details and you're not reading that situation, you might be responding with big picture and vision and completely being in two different places. So emotional intelligence and understanding other people is extremely important. But I just want to draw upon that. In order to have the ability to understand other people, you have to understand yourself. And if you don't understand yourself as a leader, you can have all the emotional intelligence on understanding everyone else, but if you don't have the awareness of your capabilities and yourself, it's very difficult to lead.
Okay, so now that we understand the role of productivity and leadership development, why not do this internally? You've got staff, people that understand the leadership roles. Why not? Why would you use an external consulting?
That is a fantastic question. It's a great point. A lot of organizations have internal consulting teams. A lot of organizations have an internal productivity group or an internal benchmarking group. In many cases, they have their finance team, they have their budget team, they have their performance improvement team. And that's all great. But the problem is that your internal team isn't as aware of what's happening externally. They can't bridge the gap sometimes between what's happening inside the organization and what's happening outside the organization. One of the biggest analogies that you might hear in performance improvement, leadership development, is that if you are inside the frame, you cannot see what's outside of the frame. So number one, external consultants are going to help you see outside of that frame. They're going to share what's happening outside within the industry, working with thousands of organizations across the country. They may have access to that, hundreds of organizations. They're aware of what other organizations are doing. So they're bringing best practices to the table. They're also, the coach behind the scenes, if you will. You might be running the same play over and over and over again, trying to understand how you can reduce your operating margin. Maybe you're losing $2 million a month. Maybe you understand that your length of stay is long, and you're doing the same thing over and over again, but you're getting stopped at the scrimmage line. And in fact, you're maybe losing 3 yards on the play, but you don't know how to go in and pivot and change the play. So external consultants give you the knowledge, the expertise, the best practices to pivot and change the play. The second thing that external consultants are going to do is they're going to free up time and give you the time and actually help you to deliver faster. So they bring urgency to the table. They bring time to the table. Your internal team, Mickey, might be completely and totally spread out right now. They might be going from meeting to meeting to meeting without time in between their schedules. So external consultants are able to create the urgency in the situation and then put that basically on fire and help you to get the results faster and give your team extra time to actually realize it.
And also then your leadership gets the feedback as well. So there are things that they want to learn. We just were talking with a prospective client just yesterday, and they were saying they would like a takeaway as well, that they're trying to do internal management, but it takes away from their other duties, and then they don't get any fulfillment from it either. And we all need a coach. And everything you were saying, it just reminds me of coaching, which you brought up. So a coach will stand on the sidelines and watch the play as it's going, make sure everything's going well, make changes on the spot. They will review old films of other teams and their team and see best and worst and implement, right?
Absolutely.
And then they will coach to where the team is at and then elevate them to get them to where they are. So kind of like Ted Lasso. That's what I was thinking about, Ted Lasso. So So
for those of you that know me, you know how much I love Ted Lasso. Believe is believe.
So talking about coaching and talking about all the things that we've discussed today, let's talk about why Altius and why Altius is like the Ted Lasso.
So I actually want to go back. We'll touch upon that in a second, but I actually want to go back to the coaching for a second. Because, one of the things we often hear in the consulting industry is, well, we don't want to become dependent on consultants. Or, we don't want to bring a consultant in because we've had a bad experience with a consultant. And yes, you're going to always experience these things. And sure, you don't want to become dependent on an external resource. However, I want you to think about all of the sports teams that you have ever seen in your entire life, every sports team. They may reach the Super Bowl. The hardest thing to do, by the way, is to repeat after you've won the Super Bowl. So if you're at best practice already, the hardest thing is for you to be best practice next year. So you need someone to get you there. But the thing is, you're never going to see a team that won the Super Bowl step aside and say, you know what? We just won the Super Bowl. Let's get rid of the coach. In fact, we're not going to replace the coach. We're just going to operate without a coach. Our quarterback, they were great. They know what they're doing. They're going to be able to run the plays. Our offensive line, they're strong. We don't need the coach. We're just going to go out and do what we want.
Yeah, you're right. And when you think of sports dynasties, to continue that analogy, you'll see the coaching and the continuity of the coaching is really what brings those dynasties to life. There may be many players in and out on those teams, but the coaching stays consistent.
So operating without a guide, operating without a coach, operating without a consultant, regardless of what your organization needs, it's important to have someone that's seeing the things that you cannot see.
Big picture,
communicating the levers and the steps and the best practices that you're not aware of, pointing out what you don't see. And that's the difference that a coach, consultant, whatever you want to refer to it as, makes a difference. Now, why Altius? What makes Altius different? Really, what makes Altius different in the industry, or what separates us, is because we really focus on the end results and that marriage of productivity and workforce optimization with leadership development. In order to optimize productivity, in order to actually enhance your efficiency, you're not going to be able to do that if your leaders aren't equipped and your leaders aren't capable, your leaders aren't confident, and they don't have the skill set. So we really strongly believe that it's going to be that marriage of those two together that makes the biggest difference. But more importantly, we focus on those end results and the fact that, productivities, it's a journey. It's not a destination.
No.
And unfortunately, sometimes we want it to be a destination, right? We want to believe that we improve by 3%, or we improve by 5%, or we improve by 15%, and we're there. But in healthcare, in any industry, healthcare especially, productivity is something that you have to focus on. So it's a destination that, really is that long-term journey, and it's continuous improvement. And when we look at it as something that's never going away, and it becomes part of our transformational culture within the organization, now we don't need to focus as much on the losses because we don't have them as often, because we're proactively addressing them as they occur, as they happen, and shifting and changing.
Which leads me to another point, timing. So why should we proactively work on productivity rather than wait until there's an issue or a problem?
So, the main point of this entire session was why wait? Why timely consulting decisions make the biggest difference, and why delays cost you money. Every time you have a problem and you're aware that there's a problem and you do nothing about it, it's like being out on the lake in a boat with a hole in it and not plugging it and waiting for it to sink with you in it. And that's what organizations do all the time. When they see the red, they know they're losing money on operations, or they're losing money in a particular service line, or they're losing money on their outpatient, physical therapy, whatever it is. They're aware of where they have the issue, and they're choosing to not do anything about it. And every minute you choose to not act, and you choose to not hire someone to support you, you choose to not do anything about it, the situation gets worse. Let's just say, for example, you're in a situation, wherever you are, drop what your 2 or 3 biggest concerns are right now. Doesn't matter what they are. Drop them in the comments, write them down on a sheet of paper near you. What's keeping you as the leader up at night? What's stressing you out? What are you losing sleep over? I want you to bring it to your mind. Now, picture the fact you're here today. If those things are still your biggest issue 12 months from now, so September 2025, or 12 months from when you're watching that, if those things are still occurring, what's your situation going to look like? And let me just say, maybe you have 380 days cash on hand, or you have 3 years of cash on hand. If you have an issue you're aware of and you're bleeding money, you're losing money, or things aren't right, or your staffing retention is poor, your morale's bad, let's just say you have a convertible with all of your cash on hand, sitting in the back seat, and you are driving down the highway and all of that money is flying out. That's what's happening when you choose to not act. And what you need to start to do is find experts that can assist you, outside resources, the playbook, if you will, and systematically start pulling the levers to shift. And you can systematically do that by rolling one window up, rolling the other window up, putting the hood over, whatever, so that cash retains. But you have to change, because if you're just going to continue doing the same thing over and over again, nothing's there. So why do you need to make timely decisions? Because you can't afford to not.
That is an excellent point. Excellent point. So what is the key takeaway for today's session?
So I would say, key takeaways for today's session really are that when you're thinking about proactive consulting, when you're thinking about your current situation at your hospital, your current situation for your department, you understand that there are probably areas when you look at your key performance indicators that could shift or change. Whatever those are, the key takeaway is, if you are aware there are areas that you can get better, you want to act upon that. And whether it's getting external resources, whether it's investing in your leaders, whatever it is, you want to take a proactive approach. So the key takeaway is, be proactive. Don't let situations fester and get so bad that you can't respond fast, because if you do, then you're going to have what no one wants, and that is a headline that talks about a large reduction in force, a headline that talks about, the worst case scenario would be the closing of your service line or the closing of your facility. And we see those headlines in healthcare every day. And our commitment is to make sure that your facility does not end up on those headlines or in those situations. But we can't support you until you allow us and commit to us helping. And so the biggest takeaway is, whatever the organization is, proactive, and don't hide from the situation.
I love that. That is great. So informative. So informative. Does anybody have any other questions? Did I miss anything?
I'd love to see a question or two. I don't think we've missed, anything that I can think of, but, I really want to play off of, a lot of the situations that we've talked about, and the fact that leadership development can be your key to improving your productivity, performance, your efficiency, and your effectiveness. And sometimes, Mickey, we look at leadership development as a cost, and we look at it as an expense. And leadership development really needs to be looked at as an investment, because that investment is going to play down all of the additional resources that we have. And that investment is going to help you be effective in all the other areas. Are you trying to meet your strategic planning goals? Leadership development is going to help you get there. Are you trying to improve your finances? Investing in your leaders will help you get there. Whatever that looks like for your organization, by investing in your leaders, it's going to help them to develop skill sets to take it to the next level. I said earlier that leaders are never going to be able to deliver their department expectations further than what their lid is. Leadership, manager, director, vice president, CEO, wherever you are, if you have made it into a leadership position, your growth never stops. So you can't think that you got the manager position or the director position or the vice president position and you've arrived, because unfortunately, sometimes what happens is you get there and people stop growing. But in order for you to consistently elevate and execute and move your organization forward and meet best practice and continue to grow and build your service line and get better market, you as a leader need to also grow and expand. Have more mentors, develop more colleague, networks, network with your peers, components. So I think we see a couple questions coming in here. So I see one. It's, what's a reasonable amount of time to start seeing change after starting leadership development initiatives? What are signs that indicate the efforts are working? Oh, Julian, that is a fantastic question. What is a reasonable amount of time to start seeing change? It's going to differ based off the actual leader and based off of where they are. But the core piece of leadership development, number one, is to become aware of where the leader's currently operating in all aspects and traits of leadership. So just understanding their leadership acumen when they're starting, and then understanding what that time frame is. Typically, honestly, with professional development, with leadership development, those leaders will start to change immediately, because they might take preconceived notions or negativity or toxicity within their department, go to a leadership development training, have a retreat, and all of a sudden they shift their perspective. And if their perspective shifts, you're going to see results from that perspective shift immediately. And you're going to see certain things start to shift. And, the culture in general is going to become more positive. People are going to feel more empowered. And as that happens, you could see results within one session. In order to start to trend and track it, I really encourage you to know what the key performance indicators are for your organization, what matters to you. Are you focused on retention and turnover? Do you want to, start to see your retention increase and your turnover go down through leadership development activities? Do you want to focus on your employee engagement? Maybe you had some really poor employee engagement scores, and you want to put leadership development into the mix to see your employee engagement scores increase. Perhaps it is on that productivity, and you want to have the leadership development to give your team permission and confidence to execute on their plans. With any of those, you could start to track and trend the performance improvement against the targets. And that's going to give you those signs that your effort is working. Do you have more empowered leaders that are coming to the table with solutions and ideas? Can you feel the energy? That is a way to tell if your leadership development and productivity is working.
That leads me to something else I was thinking about too. With you've worked with so many organizations for decades across the country, small, large, rural, urban. And so can you think of some examples where you've seen like a big cultural shift? Because it's not leadership development changes or elevates the entire culture of the organization.
Absolutely. I have a perfect example of a client that we were working with, last year in California, actually. And, initially, working through the situation, when you would walk into the organization, there was a palpable negativity. So, and it wasn't necessarily toxic, not that at all, but just a doubt, that would be there. And you would walk in and you could feel that across everyone in the senior leadership team, and just a doubt that they were going to be able to achieve their financial goals. And there was that, disbelief, disengagement, I'd say a lack of belief. By working through all the strategies and systematically coaching the leaders one-on-one and putting in place, targets and plans, every single time they would pull a lever and achieve it, they would get excited. So, if you're talking about the emergency department, when they would make a small shift that would improve the length of stay, improve the throughput, that director is now excited about it. That carries over to the entire organization. And then when you recognize and honor those departments that are starting to make those changes, the other departments want to get on board. In fact, with a client that we were meeting with, this week, we reported out their most recent results, and we highlighted 4 areas that made dramatic changes and improvements, and looked at their 3 pay period trends and productivity, and all of them were coming down. And then in the next coaching session, the med-surg director said, I'm going to be on that list next month, because now they're excited and they're invigorated and they understand what the process is. But you can't do any of that if you're not holding people accountable. You can't do that if you're not aware of the situation, and you can't do that if you're not engaged.
That's a great answer. Okay, where should an organization start first? Productivity management or leadership development?
Great question. Productivity management or leadership development. Now, my right out of the box answer is going to be both. Why pick? But the reality is you can choose either of those to start with and get the end result, but your best results that are going to happen the fastest are going to happen when you combine the two together. And that means that you can start assessing your individual departments, you can start assessing your benchmarks. You may already have that in place, but as you're doing that, you can actually train your team on change management. You can bring someone in to work with them on conflict resolution. You can bring a leadership development, journey into the coach to allow them to actually start and understand leadership traits. What is the emotional intelligence? How does that all play into everything? How do they create an action plan? You'd be surprised at how many department directors don't understand what an action plan and actually how to create it. So all of these things can support it, but the direct answer is do both. But if not, either one can start and be a great place. But don't stall, don't hesitate, and make a decision. If you don't make a decision, nothing's going to change.
Oh. What does the ideal leader look like? What qualities of a leader will drive change? Oh, that's a
Do you want to answer that first? What are your ideal qualities, and what comes to mind for you, Mickey?
Well, there's no such thing as a perfect leader, but an ideal leader will be the one who wants to lead first, who wants to take charge, who wants to develop their employees, and to engage with them and to find answers and to meet them where they are.
Definitely have to meet them where they are and understand that everyone's going to be in a unique place. I think one of the most important qualities of a leader that's going to drive change is authenticity. You have to meet them where you are, but you also have to, be authentic about it and be able to communicate, which is another important quality. Communication skills are extremely important, but above everything else is trust. If your team does not trust you, if your organization does not trust you, if you do not trust yourself, everything else falls flat. So Patrick Lencioni is very well known for the 5 dysfunctions of a team, and at the bottom of the pyramid is trust. And that's one of the biggest qualities of a leader that's going to drive change, is that trust to make the right decision, the trust to actually lead the team, the trust in the why. And that's going to drive a lot of things. And, communication always pops up. Authenticity is going to be there. And we can probably list another 20 or 30. If you're watching this, I'd love, even if it's after the fact, drop your traits of, leadership there. What do you think is most important? What comes to mind for you?
I was thinking about that, what you said about authenticity too. And I think that's part of where the confidence comes from. So it all evolves, right? So if you're confident in who you are, then you will bring those tools to the forefront. And when you're having leadership development training, you're not making yourself into fit another mold. You're taking the attributes that you have and making most of those. And then you learn others and they become secondary, and you build all of that together like a snowman.
Absolutely. Wow, we have covered so much ground today. We have covered a lot of ground today, and we really appreciate everyone joining us today. If you have follow-up questions regarding the cost of delaying consulting decisions, the cost of delaying productivity leadership development, please feel free to reach out to Mickey, reach out to myself, drop comments in the chat so we can see you and follow up with that. But, we're really here to support healthcare organizations, and we would love to hear from you if, you want a strategy session, or if you have any additional questions about what we talked about here.
Thank you so much.
Thank you for joining, everyone. Make sure you follow Altius Healthcare Consulting Group on all of the social media channels, and be sure to join us for our next LinkedIn Live. Thank you.
Take care.